Okay, we're recording. Right. So good morning. My name is Sandra Scanlan with the Parents of Children with Special Needs Network. And today we are having a great conversation with our Office of Vocational Rehabilitation here in American Samoa. And to start us off will be Dr. Scanlan, who's in charge of the Basic 110 program. And then we'll hear a little bit later about the Independent Living program with Esther. So Dr. Scanlan, go ahead. Thank you for joining us today.
Thank you very much, Sandra. Thank you for this opportunity to be part of this conversation because I think this is important. We need to get the program out into the community. So, my name is Herman Scanlan, and I am the program coordinator for the Basic 110 program. So, the vocational rehabilitation program has been around for quite a while. I think they started in 1981 when the program was first launched here in American Samoa, and it's been operating since then. Uh, so let me just talk a little bit about the Basic 110 program. You know, there are other different programs within our building, which are also under the vocational rehabilitation office. We have independent living, we have supported employment, we have transition, and we also have uh, the older blind independent living program. So all of these programs operated under vocational rehabilitation here in American Samoa. So let me just focus on the program that I am, the coordinator for. So the Basic 110 program, their primary function is to make sure that people who have been determined eligible for the program will be we will be able to get them employment based on their choices. And the way to do that, we will come down, we'll sit with them, we'll go over the program, and then we'll find out what their choices are as far as getting employed. These are individuals that when they apply, they want to go back to work, but because of their disabling condition, they cannot find jobs, on their own. So what we do is when they come here, we'll do eligibility determination. If they are eligible, if they meet the criteria for the program, and then we will develop a plan for them. A plan where it will identify what the vocational goal is, and then we'll identify the services that will achieve the goal. So let me just go through the process. Maybe that would be uh, more, well, it's going to relate more on how it works when somebody comes to the program. So when somebody walks through our door, we will take the information and we'll explain to them the program. And if they're interested, then we will set an appointment for them so that we can sit down with them and have a more in-depth conversation, which, we normally say it's an initial intake interview. So some of the things that we will do in this interview is we'll find out what exactly do they need and to make sure that they understand the requirements of the program. The Basic 110 program, the Delta Vocational Rehabilitation Program, when we determine the eligibility, there are 4 criteria that they need to meet. And just for heads up that the program is not an entitlement program, because you have to go through the criteria for those who will be eligible for the program. So when they apply, then we'll inform them about the program, we'll tell them what the program is, and then if they are interested, then we'll have them fill out an application. And the application will include an appraisal from a doctor. We will probably go after their work history. We'll go after if they're young individuals who have just left school, we'll go over their school records. We go after the assessment or any kind of evaluation, anything that they have that it relates to not only to their disabling condition, but their abilities and aptitudes, so that we can see if they, on the long run, when we start doing the planning, see that they are eligible for a job. So they would come into the office, they fill out an application, and they will go and we'll send them a medical record, for a medical form for the appraisal of their health, and they will take it to the doctor, and they will bring it back to us, and they will look at it. One of the things why this is important is because it's one of the criteria. The very first criteria, to be eligible for the program is that the individual has a physical or mental disability that's been diagnosed by a physician. Mm-hmm. So that is a very important criteria for the application for services. So the second criteria is that their disabling condition is an impediment to employment. So some individuals will come to the office and apply, although they have a disabling condition, but it does not create a barrier. It does not create an impediment for them to go and do a job. So it would be a counselor's uh, decision based on everything that they have got to see if the individual that present a disability is an impediment to employment or not. If they feel it's an impediment to employment, then they will be eligible for the program. But if they feel that it's not, then they might not be eligible for the program, because although that they're disabled, but they can still get a job. No, if they go on and find a job. So the third criteria is that through our services, once if we identify that if we provide our services to this individual, it will help them find a job, retain a job, or advance in a job. So those are basically how the services is going to be organized, or is going to be developed. Identifying the service that will help this individual if they pass the first two criteria, and then we'll see if the services that we provide is going to help them get a job, maintain a job, or advance in a job that they have. Some people that comes to us, they are already employed, but because of their disabling condition, there's a fear that they might lose the job. Mm-hmm. So through our services, we have specialized services. We can put people through training or retraining, or put the individuals through whatever the barrier that they have that will jeopardize their job. We'll find out what those are, and then we'll see if those are the services that we could provide for them. And then the final criteria is that they are residents of American Samoa. So in order for somebody to be eligible for the program, they have to meet all the four criteria of the program. They have to have a disability, that their disability is an impediment to employment, and through our services that we can provide them new employment, or we can have them maintain their employment, or even to advance in their employment. And the fourth criteria is that they are residents of American Samoa. So basically, when we go through that process, so once we do the intake interview, we'll tell them what the program is. If they're interested, then we'll have them fill out an application. And with that application that they fill out, we give them medical forms and other forms that we would like to get some information from them, so that we can do an appraisal of their physical conditions, appraisal of their mental conditions, everything that relates to the disabling condition, so that we have a full scope of what the individual impairment or disabilities are, so that we can make a determination for eligibility. So once we have passed that stage of the process, and they're eligible for services, then the next Uh, the next step in the process is we will bring them, uh, we'll set up an interview for them where they will come in and we will develop a plan of service. And the plan of services will include identifying what the vocational goal is, and then identifying what services that will be provided for them. We'll put some timelines on it, when it begins and when it ends. And we'll also identify how much the services will cost to get it provided. So once we have developed the plan and having all those uh, components of the plan in place, then we will start providing services. Again, I guess a very good example would be somebody comes in and they say, "Hey, I wanted to go and be a janitor, or I wanted to go and be a librarian or a bookkeeper, whatever employment goal that they have." But sometimes as part of the counselor's work is people would come in and they say, "I want to do this, I want to do this, I want to do this." The reality of it all is the counselor will have to make the determination if the vocational goal that the client wants to work at is a realistic goal. It's something that they can achieve. That's why we do an appraisal of of all their physical condition, mental condition, all the school records, the past work history. So, when we look at the client, we look at them holistically, every single thing that we can get our hands on so that we make sure that when we start developing a plan, that the goal is real, it's realistic. It's something that they could achieve.
Mhm.
But we don't tell them what it is. This is, we can only list, this is how council would do this. No, with, when we do an appraisal of these information that we have, then we know exactly the kind of job that they would be successful in. So what we do is we inform them of these choices. They tell us what they want to do. We will discuss how realistic that is or not. And then we'll offer them these other job options, alternatives, that based on our appraisal of all the records that we've got, it's they are jobs that's more likely they would be successful in. But we don't tell them what it is, we know what job to take, but we give them the option, we give them the test job titles, what they do, and then it's up to them to decide what they want to do. And once they identify that, and then we will find out a way that they can achieve that. If we have to put them through training,
Mhm.
that's what we do. If their disabling condition prevents them from doing it because they're hard of hearing, they have problems with their vision, we will provide those for them to make sure that they will succeed. If they needed a wheelchair or any kind of assistive technology, whether they need a special computer to do the work or some kind of software program, we will work with them so that we can make sure that those will be provided so that the individual is successful. But we can only provide these services after we have identified what that goal is and established what the services that they need.
Oh.
So once we develop the plan, we set some deadlines and dates when the service will be provided and when it ends and how much it will cost. So once we started rolling the plan out, we will make sure that the funding is available to make sure that the services that we say that we're going to do and that the office is going to provide will be provided. So that's why it's so important for us and and the individual that applied or the client that applied, that once we have this plan in place, once we have this plan in place, we make sure that there's no, when we provide the services, that we provide the services so that the funding is always available once we say the service are provided. So depending on the discussion between the client and the vocational rehabilitation counselor, how long the services will last. We will monitor, we will do evaluation, and when the person is ready, uh, so they achieve the goal, then we'll go and find a job for them.
Mhm.
So not only that we put them through training and try to figure out a job for them, but we also the VR, the basic consent program, the counselors also have the responsibility of finding a job for them. So it might take us a while. If it's hard for us to get a foot in the door, what we will do is we'll try and provide incentives for employers. And to do that, we do job training. We'll tell them, hey, um, we'll provide a job coach or somebody, just incentives so that it will make the employer more willing to hire the person that we're trying to place. And mind you, when we bring these individuals to find employment, they have been trained. They know how to do the job because those are the things that we have prepared them through when doing the plan. We're not bringing somebody who doesn't know anything about the job because that's what we do when we develop the plan, and then we provide training for them. So once an employer hires these individuals, we'll give it 3 months, 90 days, that if they can do the job on their own and successful, they don't need additional help, then we close them out. But we will continue to monitor them, their progression for a year. So basically, that's the process, and that's how and once they're successful, we'll close them, and then they're on their own. They should be independent. They're able to take care of themselves and their families by finding their employment. So that's, in a nutshell, is what we do, Sandra. We can't hear you. I can't hear you, Sandra.
Unmute now. Yeah, sorry.
Oh, okay.
So with our population, adults with developmental disabilities, they qualify, they would be eligible, assuming eligibility in all four areas. But what if they needed to have like a job coach, like a one-on-one person that needed to go in with them to help them to stay focused or to stay on the job? Do you assist with that in any way, or are parents allowed to go in and help a child with their job? What do we do with kids in this kind of in-between situation?
Okay, so yes, we provide a job coach, but the caveat to this, Sandra, is before we provide them with job coaches, we need to work with the clients first. We need to know who they are. We need to know what their disabling conditions are. We need to know what kind of job that they're going to go do. So the way that the job coach is the way, we normally do things when we engage job coach, from the VR perspective is when we have the client that we work with, we identify the job. We identify what they want to do and put it in a plan. Then we we will be able to will be able to know that because of the severity or because of the condition of this individual would need a job coach.
Mhm.
So the way that we engage job coach is okay. Uh, Before we even put them out in a job, we will identify and ask an employer if they're willing to take on this individual. If a family member is able to find that, that's even better because we can quicken the process. But once a job has been identified, then the couple, before the client even gets her foot into the door of doing the job coach is already there. He will go there or she will go there and do a complete job analysis, a task analysis of what the individual will be doing at the job. Furthermore, the job coach will be learning the task of the job.
Mhm.
Because one of the things that we tell the employer is before we even bring our people in, we'll have our own job coach come and learn about the job because business is money for them.
Mhm.
And when we work when we work with employers trying to place our individuals, we tell them if our person does not do the job as should be, the job coach will make sure the task is been done. And by doing that, the job coach will be there. He or she will learn the job before we even put the person there. So once we have a client there, the job coach should have known everything to do about the job. And that job coach will do the training, which will alleviate other employees of the employer to go do the job. But yes, it will be nice if we would be involved, at the front end of the process before the individual gets it on the job. Where if versus having somebody on the job, and the job coach will come and try to figure out what their role is as far as the support that they need. But if they do this prior to that and getting to know the client and working with them and identifying a job that is realistic for that individual, then we can go place them at that exact job that they need. And then the job coach was there to learn everything about the job before we even put the person on the job.
Okay.
I don't know if that answer. No, it's a long answer, but I think that's how the job coach works from the VR perspective.
So you also mentioned that the program goes for like about up to 90 days and they reassess to see if they're able to handle the job on their own. If they are not, do you extend it farther or do you like consider maybe another job opportunity or how would you work that if someone wasn't ready yet after 90 days?
Well, when people comes into when they apply, if through the application process we felt that this individual it's on it's an iffy whether they will be eligible for service or not. No, we don't have enough information to make a determination of eligibility. So what we would do is or it's just that the severity, although that we have the information, but we think that the severity of disability, it's kind of make them an iffy if they would be somebody that's going to be benefiting from the job. So what we do is we put them on extended evaluation. So what we do is when we put on extended evaluation, we will then find on the on the side kind of training. We'll put them on a real job site, and then we'll tell the employer, hey, we have somebody here. We wanted to know if they can do the job. But by doing that, we will be paying for the 2 months that we put them there, and we'll put on real trial work experience. And if we see that they can do it, then we'll come back and determine them eligible and then finding a job with them. If we see that they can't, then maybe we'll do another job site or two more just to make sure that we are not there are no gaps and holes through the service that we provide. So like after two or three job trials that we have done, and it doesn't end up positively for the individual, then we might finally make a determination. Well, you know what? After going through all of this, maybe finding a job, maybe getting a job and having to get employed is not an option. I mean, this is one thing when we make these decisions, and if a decision that the client don't like, we always tell them that there is the client assistance program, there is OPAD, where they can go and and complain, about the decision that we make. So if that happens, then we'll come and sit down, and then we'll tell them the reasons why. We'll give them all the records that we have, why we make a decision that we did. We can't hear you. You're on mute.
Yeah, Jasmine keeps making noises back here. I shut it off. But
All right.
okay, yeah. So I had another question. Do you support home-based businesses? If someone wanted to do a home-based business rather than work for an employer, do you help them to establish a home?
Um, that's a very good question because there is a very big misconception that's been out in the community regarding VR setting up home-based businesses. A lot of people would come here and demanding, I want you to set me up on a business or in a business. Or say, I know that you have federal dollars and there is a set aside amount from those federal dollars that you have for us that we can come in and do businesses. Going back to the process, we make sure that anyone, before we even provide services, have been determined eligible for the program. And through our extensive diagnostic studies and evaluation, we will know who can do a business and who cannot do a business. That's why we have this comprehensive collection of data and something, so that when people come and ask to do businesses, then we will have to look at that more in depth. But to answer your question, we have done businesses in the past, but it's always a individualized plan. We have gone, we have seen people that say, "Hey, I want a business that my neighbor had, and I want the same kind of business." But this is the challenge that we have. Is because we try to explain to them, although that people have the same disability or similar disability, but they have different, the way that they react to situations is different. Mm-hmm. So they cannot say because that person is disabled, he's got diabetes, or he's got arthritis, or he's got all this, and he can do that. I can do that too. That's why I'm saying it's a very individualized plan. And what we have done too is when people come and ask for businesses, we will find out if the kind of business that they want is realistic for them. And then we will find out from our comprehensive assessment of his aptitude, his personality, all of the strength and weaknesses of somebody doing a business like that. We make sure that we have covered all the bases to make sure we even consider talking about a business. And then there is always a conversation regarding assistance that we can provide regarding training for them to do a business, working with the Small Business Administration so that they can have to make sure that they do the business. We work with them doing a business plan, and we work with them to do a marketing analysis. So all these things about doing a business, we have to go through that process. But yes, if somebody comes in and say we want to do this, and then we go through all this checklist of things that we wanted to do. And what we have found out is a lot of people, really don't want to. They just want a business so that they can. When they have time, they'll go and. No, it's something that they can use for the time that they, excess time that they have. But when we start and looking at and we start to determine business and doing business with people, we make sure that this is a long-term project. It's something that it could be sustainable, because we might help them with with the initial stock or supplies to get it started, or we can partner with them if they already have stuff that they can do, that they have already built towards doing the business, and then so we partner with them, then we can provide the other stuff that they don't have. But the goal is when we provide these services and it folds within the year, we can go and reprocess everything that we have bought for them. If it's something that we have assisted them with the business and they didn't put it in use the way that we say they're going to do it, then the office will reprocess all that. If they lost it or it's stolen, they will be paying for it. They will be paying for VR for the. So it's so easy for them to come up. Hey, we want a business and do that. But for example, somebody say, "Hey, I want an excavator. I want a cement machine to do my business." And I go, "What kind of business that you're going to do with not doing this just one cement thing?" But those are the kind of things that we look at. We make sure that when they talk business, it's a real business, not just something that they wanted to do, and then all of a sudden, no, it folds.
Yes.
And then we have a contract that we sign with them that when it folds within a year and it was not a success, then we will go and reprocess everything that we have given them.
Okay. All right. So my other question was, do you have difficulty finding employers that will hire your clients?
Can you repeat that, Sandra? I didn't get.
Oh, do you have any difficulty finding employers who will hire your clients?
Yes, I think the past 3 years, out of the people that we have close competitive employed,
Mhm.
99.9% are self-employment
Mm,
because employers out there would not hire individuals with disabilities. You know, we I have tried going out 3 times and talk to employers without without disclosing them who the people that I'm representing. And I got a very positive, feedback from these individuals. I went in there and said, "Hey, are you guys hiring entry level jobs?" And say, "Yeah, yeah, we're looking for." Okay, and then ask them for the process. I think it's still it's the stigma, it's still um, thinking, the mentality that still exists that people just basically can't do a job. They are high risk and prone for accidents or things like this, and employers would be putting the next out, especially with no for liability if something happens on the job. But then this is where we try to so and then that's our biggest setback in regarding. So what we do is we try to work with people with family members who have businesses, just to get them in there. But eventually, we're we're trying this out again. We're setting up schedules that we can start going out and talk to employers about this. But yes, the difficulty is
yeah.
the disabling condition that individuals have.
Yeah. Yeah, I was thinking about that. It might be good to have just an outreach to employers and let them know, how you train ahead of time. You can send people to learn the job. You can have a job coach, we're going to pay their salary for the first 90 days, all these things that they need to know. And if it doesn't work out, it doesn't work out. But yeah, how great it would be to have more employers or just businesses that were set up for persons with mental and physical disabilities.
Yes, that's why we have all these incentives. That's why, we try to, when we do the plan, we try to train them before that we go out and look for jobs for them. Because, we're not bringing, we're bringing somebody who knows how to do the job. We're not just bringing somebody, that doesn't know how to do the job.
The last thing I just wanted to bring up is that according to your website, okay, so you have changed offices now. You're right downtown there by the hospital. And
Right.
the building that used to be the bakery, that big new building, you have the whole building. That's great. You have all these programs, and your phone number is now the same number, but 633-1371. So when you're looking at the website here, just change 633.
Correct.
Yeah. Okay. Um, I don't have any more questions. Did we have, is Esther available? Did she want to come in and talk about independent living?
Yeah, I think she is available now, but she needs to get online.
Uh-huh. Yeah, we'll get her on. So,
Let me go see if she can sign in.
okay. All right, then.
All right, just hang on.
Let's talk a minute here. Okay, so we had a really great interview this morning with Vocational Rehab. They are located down now by the hospital, where the Amy's Bakery used to be, that building that was rebuilt. Their number is 633-1371, and they have all kinds of programs. But we were just talking with Dr. Scanlan this morning about the basic program and the eligibility requirements to be part of the program, and then all the support services that they provide in helping the individuals
Hey,
to
Sandy,
so now we're going to talk with,
can you hear me?
yes.
Yeah, so I just talked to the director, and I think Esther is in the middle. She might be working on the class a little bit longer, so she
No,
was saying that we might put her on another day.
yeah, I think we'll do that because this was a quite a lot of information at once. And I think maybe I'll just meet up with Esther on another Zoom meeting to talk specifically about the independent living. So,
Yeah, if there's anything else that you need from me, let me know, and I'll work with you on it.
all right. So thank you so much. We'll stop now.
All right, thank you.
All right. Thank you so much. Okay. Bye.